There's been a 50% increase in vaccination uptake over the past 2 days. As a result, Minister of Health Terrence Deyalsingh said the ministry had to reconfigure its vaccination sites. Kimberly De Souza has more in this report.
Sinopharm, Pfizer and Johnson & Johnson vaccines will be available for all members of the public at 15 mass vaccination sites, including drive-thrus, from Thursday. Minister of Health Terrence Deyalsingh said the Pfizer vaccine will be offered to anyone over the age of 12. Some of the vaccination sites include the paddock at the Queen's Park Savannah, Larry Gomes Stadium, Sapa in South, and Mason Hall Community Centre in Tobago. The Hasely Crawford Stadium and the Frankie Boudram Wallerfield International Raceway will remain drive-through sites.
At the health centres, the Sinopharm vaccine is available at all health centres as they have always been, and the Johnson & Johnson COVID-19 vaccines are all available. One shot and done.
Minister Deyalsingh added that 2 of the vaccines will be offered at the various health centres across the country. Those wanting to take the AstraZeneca vaccine will have until Thursday to take the first dose.
Because the AstraZeneca vaccines have an expiry date of between October and November of this year. So we have to allow for the 6 to 8 week period to elapse between when you get your first dose and your second dose.
He said there are still 28,000 doses of the AstraZeneca vaccine available for people to take their second dose. People can visit Sapa in South and the paddock in Queen's Park Savannah for the second dose of the AstraZeneca vaccine. Kimberly De Souza, TTT News.
Meanwhile, Principal Medical Officer of Health, Dr. Miriam Abdul-Richards, says the Ministry of Health has been boosting the parallel healthcare system since the arrival of the Delta variant.
We intend to increase the number of intensive care unit beds by approximately 50 in Trinidad and Tobago. Given the number of pediatric cases that we have noted, we have also increased and allocated resources for the ICU and HDU level for pediatric cases as well as maternity cases.
Analysis of severely and critically ill patients admitted to the hospital over the past 76 days, Dr. Abdul-Richards revealed a concerning statistic.
0.5% of those persons admitted into the severely and critically ill hospitals are not fully vaccinated.
Dr. Abdul-Richards said she continues to see high occupancy levels in the parallel healthcare system and reminded the public that there are a limited amount of resources.